hemorrhoid surgery. We intended to help you to understand the surgery process and to find the most suitable treatment through the following video. What are hemorrhoids? Hemorrhoids are venous swelling in the lowest part of your rectum and anus. It mainly came from a long-term increase in venous pressure, such as constipation, pregnancy, and squatting. 3 types of hemorrhoids. 1. Internal hemorrhoids, the most common. The main symptoms are bleeding, prolapse, and pain. 2. External hemorrhoids, under the skin around the anus. The main symptoms are foreign body sensation, pain, and bleeding. 3. Mixed hemorrhoids, combines the characteristics of internal and external hemorrhoids, such as pain, bleeding, and foreign body sensation. For internal hemorrhoids, grades and treatment. Grade 1. No prolapse, bleeding without pain. Diet control and topical ointment. Grade 2. Prolapse upon bearing down, but spontaneous reduction. Medical treatment with stool softeners or topical ointment. Grade 3. Prolapse upon bearing down requiring manual reduction. Surgery or rubber band ligation can be used. Grade 4. Prolapse with inability to be manually reduced. Surgery is necessary. External hemorrhoids, they are covered by skin and usually without bleeding and pain. When a thrombosed external hemorrhoid occurred with severe pain, surgical treatment is mandatory. There are 3 different treatments to the disease. We list 5 considerations that you may concern to help you make the best decision. P. Please check the following factors. When you check the items are mostly important, it means surgery may be more suitable to you. Your subjective feeling is as important as objective medical data. Then please think about what is more important to you. When you check the items are mostly important, it means that you are suitable for surgery to treat your symptoms and improve your quality of life. 8. You have to know the risk of hemorrhoid surgery. Short-term pain. In traditional surgery, bleeding, less than 1%, dysuria, in 10 to 50%, difficult stool passage, due to pain, infection, rare. Long-term, bowel incontinence, very rare, anal stenosis, needs anus expansion or reoperation. 9. Procedure for prolapse and hemorrhoids, PPH. It is a new type of minimal invasive surgery, which can manage both internal and external hemorrhoids at the same time. The post-operative pain is less than the traditional surgery and recovery period is shorter. Now that you have known about hemorrhoid surgery and your own feelings, please choose the surgery type you want. 11. Before making a decision, you can also think about the following questions. If you still have doubts about the treatment, we are willing to explain and discuss it again. When you decide to receive the operation, the following preparations related to operation are important to you. 1. Do you get complete information before surgery? Healthcare providers will always provide related assistance. 2. Is the surgery consent completed? 3. You will undergo preoperative assessment by anesthesiologist. 4. We will offer you with the surgery-related precautions. 13. Can I choose the general anesthesia or regional anesthesia by my will? Here are 4 steps to help you to choose the type of anesthesia. Because health condition of each person is different, it is necessary to ask for expert advice from anesthesiologist. Step 1. Advantages and disadvantages of general and regional anesthesia. General anesthesia, pain-free during the process, but may have dizziness after surgery. Not suggested for inadequate fasting hour and poor dental condition. Regional anesthesia, awake during the procedure, usually takes 5 to 10 minutes, but obesity and lumbar spondylosis will increase technique difficulty. Should be avoided when patient cannot cooperate or suffer from infection. Step 2. Common situations before anesthesia can further help you to choose the optimal anesthesia method. General anesthesia is more favorable to you when lumbar spine is degenerated, anxious to and afraid of back injection and unable to cooperate during injection. Step 3. Consider the advantages and disadvantages of anesthesia in Step 1. When you feel that items 4, 5, 6 are more important, regional anesthesia will probably be more suitable to you. 17. Step 4. Are you ready to make a decision? Please consider whether you have understood the benefits and risks of different anesthesia methods. If you still have doubts about the anesthesia methods, we are willing to offer you with more information and explain again. Several important preparations must be done before surgery. 1. Fasting from midnight before surgery, including water, cigarettes, and betel nut. Preoperative fasting at least 8 hours may reduce the risk of aspiration pneumonia. 2. All movable denture, metal ornaments, contact lenses, underwear, makeup, nail polish, and crystal nails must be removed at the day of surgery. 3. Before entering the operating room, please void yourself. Put on the surgical clothing and paper cap. 4. You shall be accompanied by an adult family member. Pay attention to the way of dressing. Our nurses will check your identity and surgical site for the first time. When you enter the operating room, we will help you to move to the operating table. Before the anesthesia begins, we will check your identity and surgical information for the second time. When regional anesthesia is used, we will assist you to keep correct lateral position. Anesthesiologist will disinfect the puncture site and indwell the epidural catheter. Please maintain your posture and do not move your body to ensure the safety during anesthesia. There are lithotomy and prone positions for hemorrhoid surgery. You will be transferred to the recovery room after the operation. 2. 5 important reminding after operation. 1. Normal bowel movements after operation. If you have difficulty in defecation, the doctor will give high-fiber softener to relieve symptom. 2. Care of the anus wound. Remove the gauze at the day after surgery and begin to take warm water bath. Take bath regularly and after defecation, each bath for 10 minutes. Water temperature is the same as shower water. Take bath 4 times per day during first week, 3 times per day during second week and twice per day during third, fourth week. Do not add cleaning agents into bath water to avoid irritating the wound. Wipe the wound after bath and keep left lateral position. Put on ointment with the index finger into and outside the anus, and then cover the anus with gauze. Fingers need to be washed and nails need to cut short. 3. Will defecation cause the wound dehiscence? It is normal if defecation come with a little blood. It usually heals within 2 to 3 weeks. Defecate regular daily, intake adequate water and keep the stool soft. Since wound in the anus is double sutured, don't worry about wound dehiscence during defecation. Removing stitches is not necessary, the suture of wound will become self-absorption. 4. Postoperative pain. Wound pain occasionally occurs at the operation day. It will lead to difficulty in voiding. It usually subsides when painkiller is used. Postoperative pain is uncommon in procedure for prolapse and hemorrhoids, PPH. Just take analgesic pills given by the doctor. 5. How to deal with postoperative anal stenosis. Anal stenosis may occasionally occur due to scar contracture at 3-4 weeks after surgery. The doctor will pay attention to it during regular follow-up. If stenosis occurs, it usually recovers within 2 weeks by topical ointment and finger expansion. 3. We believe that you have an initial understanding of hemorrhoid surgery after watching the previous contents. The following quiz let us remind you some of the important message. Please check the following items and thank you for your valuable advice.